Do you want to have a healthy heart? My name is Dr. Ngozi Onoha, and I'm here to talk about how to have a healthy heart. I want to talk about cardiac risk evaluation and other things that people can do to have a healthy heart. Why is heart disease a problem? Heart disease is a problem globally, not just in the United States, but everywhere else. In the United States, heart disease is the #1 cause of death in adults. And this is a huge problem because some of the contributing factors that cause heart disease can be prevented to some extent. So these are called modifiable risk factors. So I'm going to talk to you about atherosclerosis. This is a condition where waxy substances build up on the inside of blood vessels. And interestingly, people in their 20s, 1 in 10 of them, has silent atherosclerosis, so without any signs or symptoms. And if that person has other modifiable risk factors like obesity or diabetes or high blood pressure or they smoke, their risk of atherosclerosis is even higher. So I'm going to talk to you about how to have a healthy heart. It's not that difficult. It does need some work on your part. It's not automatic. So as mentioned, there are some risk factors that we can control. So we can control how we eat. We can control our lifestyle, our activities, and the lifestyle choices that we make. And all these things add up to a cumulative effect, sort of an additional effect, like layers upon layers upon layers. And without changing these bad habits, we are on a straight road to heart disease. I'm going to talk about Q-Risk3. This is a validated calculator of a person's risk of having heart disease or stroke in the next 10 years. This is a simple calculator that is available online, but you do need to get some computations to add, like your cholesterol numbers, your blood pressure numbers, your height, and your weight. And you would impute those numbers into the calculator and get the age of your heart. So I'll give you an example. So let's meet John. John is 40 years old. John is a plumber. He's a very busy guy. He gets called out day and night to help unclog different things that have happened, unclog pipes, especially over the holidays. He's unclogging sinks all over town because they're blocked. And so John is very busy. He doesn't have time to prepare meals and he's running around eating a ton of junk food. So most of the meals he eats are meals that he grabs on the go. So they're meals laden with a lot of saturated fats and processed foods. And so he has also obesity because he doesn't have the time to exercise. Once he gets home from work, he sleeps and then he's up again running around doing his work. And John was diagnosed with heart disease. He started having chest pain. He's only 40 and he started having chest pain. He went to see his doctor and his doctor told John that John had an elevated blood pressure and also had heart disease. So here we have John with heart disease. So what can John do? John can take his prescribed medications. Lots of people are afraid of illnesses. They are diagnosed with blood pressure, high blood pressure, or they are diagnosed with high cholesterol or diabetes, but they are afraid of the medications. These medications are safe, they've been scientifically studied, and it's easy to take these medications and be healthier. Blood pressure control is essential to good heart health. So if you've been diagnosed with an elevated blood pressure, follow your physician's instructions and take your medications as prescribed. It is important to go for regular checkups and also regular blood tests at least once or twice a year, or as your doctor requires you to do so. Monitoring your blood pressure is important. If you've been prescribed high blood pressure medications, you need to invest in one of these. This is an automatic blood pressure cuff and it is very easy to use. You can get this from any drugstore. CVS, Walmart has them. They work quite well. almost as good as what you will get in the doctor's office. So if you have high blood pressure, you should be monitoring your blood pressure at least once a week, or as your doctor advises you to do so. And these go for, depending on where you are, you can get it in Walmart for about $50. If you have good insurance, your insurance company might pay for it for you. So ask your doctor to order a blood pressure machine for you. It's very important to check your blood pressure regularly. Checking your blood pressure in the morning is an ideal time. This tells you how the blood pressure has been through the night. If you're not able to check your blood pressure in the morning, check it in the evening, and also check it in both arms. Write down the blood pressure reading that is higher. In the description of this video, you're going to find a blood pressure logbook. You can purchase that book and write down your blood pressure readings. When you go to your next physician's appointment or provider's appointment, you can take that book along with you so they can see how your blood pressure has been doing. Definitely engage with your doctor and find out what the expectation is of you. When you have high blood pressure, you will follow with your doctor on a regular basis, and your doctor will guide your therapy. And your doctor will be able to tell you how often you should check your blood pressure. Write those readings down. Your doctor will tell you whether or not your blood pressure is controlled, and your doctor will tell you about your blood tests. And this is important to know. I'm going to share some helpful tips to help you remember how to take your medications. A lot of people don't take their medications just for the simple fact that they just can't remember. And it's so easy. We all walk around with cell phones, and you can set a timer that says take medications. If you're taking medications once a day, set a timer for once a day. And if it's more often, set a timer for 2 times a day or 3 times a day as required. If your blood pressure is not controlled and you are obese, so your body mass index is more than 30, think about the fact that you may have a condition called sleep apnea. When you have sleep apnea, you don't breathe properly at night, so your body does not get enough oxygen, and this puts a strain on your heart and other organs, and so the blood pressure might not be controlled. So if you have uncontrolled blood pressure and you're on so many medications and you have obesity, ask your doctor or provider to check you for sleep apnea. I'm talking about how to have a healthy heart. Ensure that your cholesterol numbers are in range. Talk to your doctor if your cholesterol numbers are out of range. Another important thing is to know your A1C. Lots of people don't know what A1C means. A1C is a reflection of blood sugar control over time. It can also be used to diagnose diabetes. So people with an A1C of 6.5 or greater have diabetes. So know your A1C. That way it keeps you on track. If you are borderline for diabetes or you have pre-diabetes, this helps you keep your sugar intake in check. Get used to discussing lifestyle and health with your family and friends. Do not eat heavy carbohydrate meals after 7 p.m. just before you go to bed. Incorporate daily exercise into your routines. Try walking for 30 minutes every day. If you can, try lifting weights, light weights, 3 times a week, and stretching before you do any kind of exercise. Avoid drinking sugary drinks as much as possible. Avoid smoking and limit your alcohol intake as much as possible. This video is part of the Cardiac Risk Education in Multicultural Communities in Philadelphia. Funding for this project was provided by Healthy Voices Impact Fund at the Community Foundation of New Jersey, which was funded by a contribution from Janssen Pharmaceuticals, Inc. If you like this video, please subscribe to my channel, share with your friends, and see you in the next video.